Hi, I'm Jenny Gilbert. I'm one of the Specialist Midwives for Infant Feeding. Welcome to this Infant Feeding Antenatal Class. This is just really an opportunity for you to prepare for your baby's arrival. It might be that you've already decided that you want to breastfeed and you're here for more information just to help you prepare. It might be that you're very undecided yet about how you want to feed your baby. So you're here for a little bit more information to help you make a decision. So it's absolutely fine if you're not sure. You don't have to decide how you want to feed your baby yet. You can actually wait until they're born and you can make that decision when you're holding them in your arms, okay? But at this class today, we're going to give you hopefully enough information for you to help make that decision or prepare you. We'll discover the value of breast milk, some of the benefits for yours and your baby's health. We'll also have a little look at hand expressing and how this can be really useful for you when you're getting breastfeeding off to a start. We'll also discuss meeting your baby and having skin-to-skin contact at the birth and how this is really, really helpful for your baby learning to feed. We'll also have a look at sort of things like positioning and attachment when you're breastfeeding, so that you can get that off to a good start and avoid any problems, and signs that you will be able to tell that your baby is feeding well and that you don't have to worry about how much milk they're getting and that sort of thing. With very common worries that we find with new mums. We'll also have a look at responsive breastfeeding and how this helps with yours and your baby's early relationship and what positive impact that has for your baby's development as well. And we'll let you know what support's available for you when you get home, because it does vary from area to area. So if you're in our local area, we can tell you what we'll be able to do for you with breastfeeding support. But also if you're out of area, we can give you signpost you off to a few other resources as well that might be useful after you've had your baby. So we're just going to start with having a little look at the value of breast milk for health. So you're here to find out more about breastfeeding, and one of the things that's really important for you to know really is what are the benefits of breastfeeding. I'm sure you've heard that it is good for your baby's health, but it's also good for your health as well. There's lots and lots of properties in breast milk, and it's all very well researched, very well evidenced now. So we have a wide range of strong evidence that tells us that breastfeeding can help improve many health outcomes and reduce the risk of many health problems as well. So let's have a little look here first at human milk versus bacteria. So this image is really good. It's an image that was posted on Facebook by a biology student. So she had colonised some petri dishes here with bacteria M. luteus, except for the centre where she's dropped in a little bit of breast milk, as you can see on the image. So what breast milk is doing here is you can see that it has provided protection against that bacteria. And this is one of the overarching properties in breast milk. It is so fantastic for fighting infection. Breast milk contains things like immunoglobulins, enzymes, certain proteins, healthy bacteria, and white blood cells. All of these things really contribute to its ability to fight infection. It has the ability to target, capture, destroy and engulf bacteria and viruses before they even get into your baby's system and become an infection. So really amazing quality. And it's definitely something that you should take on board, to think about protecting your baby against infections, especially when they're first born and they have quite an immature immune system. It also protects their gut, it coats their gut, it protects the gut lining, and it prevents bacteria from entering the body via the gut. And this also protects against allergies, common allergies like eczema and asthma as well. So as we've just learnt there, did you know that there's actually more white blood cells in 1 teaspoon of milk than there is in 1 teaspoon of blood? It's quite amazing really when you think about it, that the fighting properties of breast milk is that significant. We think about white blood cells in our blood as the immune fighting, the antibodies protection against infection. And one of the useful things that you can remember about this fact here really is that when your baby's born, if they get a kind of eye infection, it's quite common for newborn babies to get sticky eyes. A lot of mums have found great success by just dropping a few drops of breast milk into the eye, like eye drops, because the breast milk itself will clear any bacteria out of the eye and it can clear away sticky eyes really quickly. The same if you get a sore nipple that potentially could become infected, then you can use breast milk just to settle and soothe that wound really, and it really helps with healing. Babies are that are breastfed are 15% less likely to develop juvenile onset diabetes. So this is type 1 diabetes that comes on in childhood. Diabetes and the prevalence of type 1 diabetes is on the increase in this country. It is a problem, it is getting more prevalent. And we know that breastfeeding is one of the things that you can do to try and bring down the risk of your baby developing diabetes. It's especially important if you have a family history of diabetes, if you yourself are a diabetic, and particularly if you are a type 1 diabetic, then this really should jump off the page to you. This should be something that is glowing with appeal, so something to definitely consider. We also know that babies who breastfeed are much less likely to develop very common respiratory infections. So things like chest infections and bronchiolitis often cause babies to be very poorly, and into toddlerhood really can result in admissions because of how seriously that's affecting them. So when you breastfeed, you do reduce the incidence of your baby having these sorts of problems. And there's a benefit for you as well, because breastfeeding greatly reduces your risk of developing breast cancer and ovarian cancer later on in your life. And it is quite a significant reduction. It can range anything between 20 to 30% reduced risk of developing these cancers later on in life. And again, if you've got a family history of breast cancer, it is something that will be of interest to you. And it definitely does reduce the risk of those hereditary type, gene mutation type breast cancers. There's also the benefit that breastfeeding is completely free. It doesn't cost you anything to breastfeed your baby. Whereas obviously if you decide to formula feed, you will have to lay out some costs to purchase your formula. There's no getting around that, where you have to buy formula milk. So on average, and this is a very average estimate really, annually it would cost you around £800 to buy your powdered formula for your baby's supply for that year. If we break that down to a monthly cost, then that's about £65 a month. And that's not taking into account the cost of bottles and teats and sterilising equipment. So it's potentially financially might be something that you really have to consider. It depends. We all have very different circumstances, but it might be something that appeals to you. Breast milk is also, and this is a really, really wonderful thing to bear in mind, breast milk is also known to be lethal to over 40 types of cancerous tumours. So the variety of tumours out there, 40 of them, breast milk is lethal to them basically. So with this, we know that it reduces the risk of your child developing cancer. And it's a worrying thing, isn't it? We know the risk of cancer is high, tell you 1 in 3 of you will get cancer in your lifetime, and it's scary. We all think about that, but we know breast milk now has a protein within it that is lethal to tumours. So a really interesting one there, and definitely one that's worth bearing in mind. So we'll have a little look at colostrum now. So colostrum is the first milk that your baby will feed from you. So this milk, we call it the superfood of milk really. It has so many benefits for your baby. Another name for it is liquid gold, and this comes from the fact that it has a kind of golden appearance to it. It is nature's first milk and produced. It's actually produced pre-birth in your 3rd trimester of pregnancy, while your breasts are maturing and the tissue inside your breast is changing and getting ready for the arrival of your baby. It will start to practice making milk. And so some of you may be leaking colostrum and some of you don't. In either way is perfectly normal. But if you do leak colostrum, do not worry about that. That is absolutely fine. But it does have this golden appearance to it. If you look at the syringes down the left-hand side of the screen here, it doesn't look typically like milk. It doesn't have that white creamy appearance that milk has. It's a little bit more see-through. It has this sort of yellowish appearance. It's quite thick. It has the texture of syrup actually. It's kind of thick and gloopy, and so it we call it liquid gold, but it's also liquid gold because money couldn't buy colostrum. It is absolutely fantastic for your baby, and so it's definitely of value to them no matter how much they get. So colostrum comes in very small volumes. It's not provided in great big voluminous feeds at all. It comes in really just a few mil per feed. We'll talk about tummy sizes and feeds later on, but if you were to express colostrum, you'd probably express in the volumes you're seeing on these syringes. So they're all 1 ml syringes. So the top one is like 0.2 of a mil, and then we have 0.1 of a mil, and then the bottom one, it's full, is just over 1 mil. So you can see it's very tiny amounts. But what you have to know about colostrum is that it has all of the same properties of full milk. It has the same calories, the same nutritional content, and it's loaded with antibodies, but it is very low water volume. What that is like nature's protection for your baby's immature kidneys, really. When they're first born, they're born with extra fluid on board. They're quite puffy, a little bit swollen. And in those first for 24, 48 hours, your baby's kidneys are working extra hard to process all that extra fluid. So we know they'll produce plenty of wet nappies, even though they're only having small volumes of colostrum. And that's the way that nature intended it. Like I mentioned, it has lots and lots of antibodies in it. These are tailor-made antibodies from your immune system. So any pathogens that you've come into contact with throughout your life, your historical pathogens, where your antibodies you carry around with you, but also the environment that you're living in, those antibodies are produced, passed straight into your breast milk. So your baby gets designer antibodies from you, made specifically for them and their family and their environment. So we encourage you to stay with your baby as much as possible and spend lots of time being close in those first few days so that you can protect them. It is also a laxative. So colostrum is kind of, again, nature's way of kind of purging your baby's system, and it helps pass that meconium, which is the name given to the first poo. Meconium is basically a buildup of residue in the baby's bowel that needs to be eliminated, and it often contains quite high levels of bilirubin in meconium. So if your baby excretes that meconium really quickly, there's no time to reabsorb some of that bilirubin. So it can help in reducing your baby's risk of developing jaundice, which is normal, but some babies do get more jaundice than others. So hand expressing is a really useful skill to have alongside breastfeeding, and it can be used to collect some colostrum that we've just talked about in your pregnancy, which is perfectly safe to do so. So if you were interested in hand expressing some colostrum, you can do this beforehand. We usually recommend that you don't start until after 37 weeks, but you can start hand expressing colostrum and storing that in your freezer, which you can bring into hospital with you once you're coming into hospital to either have your baby. Just bring that in with you. In particular, it's very useful if you're having a baby that may be what we call higher risk of low blood sugars, particularly if you yourself are diabetic. So that might be that you have pre-existing diabetes, or that you have become diabetic in your pregnancy, and preparing for your baby who we know is at more risk of having hypoglycemia, it is a great thing to do. So antenatal hand expressing is something that we recommend for you, to bring in that colostrum so that we can assist your baby in that first few hours after birth. If they don't feed, we've got colostrum ready for them, or we can use colostrum to top up their feeds just to protect them from reducing their blood glucose levels. It can also be really useful if you've got a baby who's having a few problems latching. So some babies are born and they're a little bit sleepy and a little bit slow to get started. Hand expressing is really useful because you can get some colostrum to give them in the meantime. It's really good to tempt them to breastfeed. So just being able to express a little bit of colostrum onto your breast so they can smell and taste colostrum to entice them into breastfeeding. It can be really useful if your breasts are quite full or tender, or if you feel like you may be getting any blocked ducts or swollen tissue within your breast. You can use hand expressing to relieve that. So let's have a little look at a nice simple hand expressing technique that you can learn. You can start, like we've mentioned previously, you can start this technique in late pregnancy in your 3rd trimester after 37 weeks, or it's something that you can practice just in readiness for your baby's arrival. What we recommend is that you have a nice clean, possibly a sterilised container to collect your milk in. We will provide you if you want one of these cups, and we can talk about how you get hold of these at the end of the class. And also we can provide you with some of these little syringes here, which collect colostrum quite nicely because it's so small volume. These are just 1 ml, so you don't have any wastage in the syringe. So first of all, before you start expressing, obviously clean your hands, wash your hands nicely, make sure that they're nice and clean, use some antibacterial gel on them as well. And we're going to talk about hand expressing and also some of the physiology of it really. There's two hormones that are really useful when you are breastfeeding. They're essential. We have the milk making hormone, which is called prolactin, and the milk releasing hormone, which is called oxytocin. So one of the things that you can do to try and help increase the release of these hormones while you're hand expressing is a little bit of breast massage and nipple stimulation. Okay, so what we recommend is to begin with that you just give your breasts some massage. Okay, now it helps if your baby is nearby as well, because if you have your baby nearby, then you release oxytocin. If you're still pregnant, then something to think about your baby, maybe a baby grow, or something, an ultrasound scan picture, something that gets your hormones going. If you're separated from your baby after the birth, then a piece of clothing or a photograph, something that will help those hormones flow. So lots of firm circular massage strokes around the breast, or you can do some kneading of the breast. Just gently, obviously don't be too firm, it needs to feel nice as well. So just round the breast tissue here, and all the way around. So remembering you have to do every part of the breast. Some people quite like the sort of finger tapping on the breast, but another one that's quite useful is to just do nice firm strokes down the breast and just kind of engage the nipple a little bit here, because at the same time as this you're also doing some nipple stimulation, and this is really good. So you're getting the oxytocin, and then with the nipple stimulation you're getting the prolactin. Okay, so also a little bit of nipple rolling just as you do that, so nice firm strokes and then just onto the nipple. And sometimes really most of the time you won't even be aware that you're releasing these hormones, they'll just be happening in the background. So for this, really you look at it just a couple of minutes before you start, just to kind of loosen this all up a little bit. So like I say, lots of variety of massage strokes there that you could try, so have a little go, see what you prefer. When you're ready, when you've done your massage and you've been doing that for a couple of minutes, what we recommend is that you make a C shape with your finger and thumb. Okay, so these are going to be the fingers that you're going to use on your breast for expressing. So taking your fingers back, so if we could say this is the base of the nipple here, we want you to take your fingers back about 2 to 3 centimeters back from the base of the nipple. This is really about finding the right spot for you. Okay, so again, we all come in different shapes and sizes. This pigmented part of your breast here is called the areola. So you have your nipple and then your areola here. Okay, and so again we have different size areolas. In pregnancy it often darkens as well, so you might have found that your areola has gone darker in pregnancy, and that's just a normal change that you would expect. So taking your fingers about 2 to 3 centimeters back in that C shape, just a nice steady compress, so pinching your fingers towards each other and release and compress and release. Now, it might be that in this spot just here, you do feel a slight change in texture of the tissue underneath. If you don't worry, that's absolutely fine. If after a few moments of compressing and releasing, absolutely nothing happens, then you can reposition your fingers slightly. You could go slightly further back. It might be that for you need to go a little bit further back, or it might be that you need to come a little bit further forward. But either way, you're free to move your fingers in position just a touch until you find that right spot. When you find that spot, the milk will come. Okay, so with nice steady compressions and releases of your breast here, you will start to notice on the end of the breast here, there is some little globules of colostrum. So it'll come out in little dewdrops onto the end of the nipple. It can be a little bit tricky when you're trying to manage collecting it as well. So obviously make sure you're nice and comfortable with your compress and release here. And when it starts to come, just kind of catch that drop on the end into the cup and keep doing that while ever it's flowing. The milk will continue to come in. It is quite slow. It does take a moment or two before that milk starts to move. So remembering, don't slide your fingers towards the end of the nipple. Try not to drag the breast forward. It won't be effective. You will not get breast milk, but also it will probably hurt. It will be really uncomfortable. So just to keep that C shape in the same spot, compress and release, and compress and release. Okay, keep working that spot. Now when the colostrum is starting to slow down or it's completely stopped coming from that spot, what you can do is you can move your fingers now, keeping that C shape, into a new spot. Now it might be that you have to reposition and go back from the nipple 2 to 3 centimeters and start again. Okay, so this is compress and release, compress and release, and keep working that same spot again. Same process, wait for that milk to flow. When it does, just catch it with the cup on the end and keep going, and keep catching those drips on the end and keep going. When the milk starts to dry up from that spot, so slow down or stop completely, you can move your hands again to a new spot. So again, you might have to go back 2 to 3 centimeters to find your right place, and compress and release, and compress and release, and compress and release. Okay, so keep trying that in the same spot. When you feel like you've worked the whole way round one breast, you can move over to the other breast and you can start the whole process again. So again, you would begin with breast massage and nipple stimulation on that breast for a few minutes, and then starting with your C shape and until you've worked all the way round. So it's really just a few minutes of expressing, really. You don't have to do this for a long time. You'll probably find that after a few minutes of working in one spot, it does start to slow down or stop anyway. If you're expressing after your baby's been born, and this is the early days and we're talking about colostrum, it is going to be slower to come. If you are beyond 3 days and your milk supply is starting to increase, after a few moments of compressing and releasing in one spot, it may squirt. But squirting is not normal when you're producing colostrum only. It's more something that you would see once your milk supply is established. But hand expressing is useful, like we've mentioned, for lots of good reasons. If you do decide to do this antenatally, so in that latter part of your pregnancy, those last couple of weeks, what we can do is provide you with a liquid gold kit. It's something that we do provide here at Kingsmill for mothers that are having their babies here, and the infant feeding team can cooperate with you to arrange whether you pick this up at one of your appointments or whether you drive by the front of the hospital and we'll run it out to you. And sometimes when they're out on visits in the community, if they're nearby, they could always post it through your door. So please do contact us. I'll give you our contact details towards the end of this antenatal class. Inside the liquid gold kit, what you would have, we normally give you at least 5 syringes, which come with a little cap on the end here. So these are all 1 ml syringes. We would give you a label per syringe as well. So any milk that comes into hospital must have your name, the date that you expressed it on. Okay, so those 2 identifiers have to be on there. And once your baby's born, we would also put the date your baby was born as well, and maybe potentially what room or bay that you are staying in the hospital. But we can also provide you with one of these cups. So we give you a small kit. We can always top up that kit if you need to, if expressing goes well. Storage wise, what we would say is if you're expressing in the antenatal period, you might want to break that up into small expressing sessions throughout the day. So you might do an expression in the morning and collect some milk in here. It might be that you get, a couple of ml at that time, and then you might decide to express again in the evening. So you think, okay, I'll use the same syringe. So you express, you collect it into the same syringe, and you're now kind of almost at a full syringe. If you're not planning on expressing again later that day, what we would recommend is that this syringe of colostrum now needs to go straight in the freezer. Okay, so you would label it up. Any milk that you're doing in between, storing in between expressions, must go in the fridge to keep cold. Okay, when you bring your milk into your colostrum into hospital, it must all be labelled, as I've mentioned, but it defrosts once you take this out of the freezer. This defrosts really quickly. A collection of syringes, let's say you had 4 or 5 syringes, you've took them out of the freezer, if you don't keep them cool while you're transporting them, they could be fully defrosted after half an hour. And if you're thinking about driving into hospital, parking up, getting into hospital, you need to keep transport these with freezer packs. So what we recommend is you buy an insulated bag, maybe a lunchbox, something that's got that insulation lining, pop an ice pack in with your colostrum syringes and transport them with that ice pack so that they don't defrost on the way in. And obviously once you get to hospital, just hand them over to the staff once you get there, let them know that that's your frozen colostrum, and we will put that straight into our storage freezer for you. We do recommend before you go home, if you have any unused colostrum syringes, that you take them with you, because if we heat them in our freezer and you're no longer a patient, we would have to discard of those or ask you to come back and get them. So don't waste them, take them with you. It's precious stuff. and you can give it to your baby anytime, even though it's colostrum. If you have any questions about this and you're not sure, obviously please do get in touch with us. We're more than happy to keep helping. So we'll just do a recap on the technique there. So 2 or 3 minutes of massage to begin with, really thinking about your hormone production here. So oxytocin, feeling relaxed, also known as the love hormone, helps your milk flow more easily. It's the milk mover hormone. Also nipple stimulation gets the prolactin released, that's your milk producing hormone. So both of these are essential when you're breastfeeding. Make your C shape with your finger and thumb and place it about 2 to 3 centimetres back from your nipple and gently compress and release in a nice steady rhythm. Do remember, avoid sliding your fingers forward down the breast tissue. It won't be useful and it will likely make you feel quite sore. When the flow stops or slows down, move your finger and thumb round, think about U-shape, that's quite a nice way to remember it. And just do the same thing again, so a nice steady rhythm, compress and release so that you're working a new section of the breast. Remember, colostrum moves very slowly, so it can take a little while. Don't expect to see something immediately, but keep going, okay? Expressing is still stimulating even when you don't have production, so it gets those hormones released, it tells your body to make milk. So it's useful in lots of ways. So let's now have a little look at meeting your baby. Okay. When you meet your baby, it's really great if you can use skin to skin to get that meeting off to a really good start. Skin to skin is now very well heard about. Lots of people know about skin to skin, and it's really well proven to help your baby in lots of ways. And it can be used beyond birth. It's not something that you just have to do at birth. You can carry on doing skin to skin in the first few days and weeks and beyond with your baby, because it just has so many benefits for them. But we do recommend having skin to skin with your baby straight away. So skin to skin really is the perfect start for you and your baby. So straight away what will happen is your baby will be born. We'll dry your baby and we'll place your baby straight up onto your chest and your tummy. We do position them quite low down, and we tend to do this position you can see in this picture here, which is kind of like a froggy position. You know, they're on their tummy and their arms and legs are kind of either side of them. We will make sure they're dry. We'll probably use a hat just to stop them from getting cold. We'll make sure you're dry as well. So if you're wearing any clothing at birth that's got a little bit dirty or wet, we do recommend you take that off so that we can keep you and your baby dry. It does stop your baby from getting cold in skin to skin, which is not what we want. We want the opposite. We want to warm your baby up really in skin to skin. We do know that if we do it properly, skin to skin will warm your baby up, so dry is very important. Hat, and then once your baby's on your tummy, we will cover you both up with a blanket or a towel, just to make sure that there's no drafts getting to your baby, and you know, they're nice and cocooned with you. We know it helps regulate their breathing, helps calm them down and slow their breathing down straight away. And also steady off that heartbeat. They've had a big shock. They've been born into the world and it was all a little bit strange. So it really helps calm them down. They recognise your voice, they can hear your heartbeat, and all of that helps to soothe them. It also helps to familiarise them with your bodily bacteria, which you might think is a really odd thing to say, but actually we all have we all have our own ecosystems of bacteria, something called the microbiome. And we carry bacteria on our skin, and much of that bacteria is quite healthy. And so transferal of your bacteria to the baby helps familiarise them with their environment really, and it's really protective for their health, believe it or not. When they take on the microbiome, the positive bacteria, the healthy bacteria which you're carrying, they take that on, and then that forms the beginnings of their own microbiome. So it gives them a really good start. The microbiome is actually really, really integral to them setting up their own immune system. Healthy microbes are like a coding system. It tells their immune system what's good and what's bad. So it's a really good start for them. So skin to skin is really, really beneficial from this point of view. It also can start to trigger newborn feeding behaviour, which is where we're going to talk a little bit more about it. That's why we encourage skin to skin really for getting any feeding off to a good start, whether you're breastfeeding or not breastfeeding. It's really important. So let's have a little look at what it does and how this is important for you. So there's newborn pre-feed behaviour. It's an underlying process of imprinting, basically. It's kind of the baby learning to recognise his mother and familiarise himself with the breast and the nipple and how to feed. So it's really important learning opportunity, and it starts with your baby's birth cry. Obviously, all babies are going to give a big yell when they're born. They'll fill their lungs with air. They'll have that huge cry. But it is quite short-lived, that big cry. They calm down nicely quite quickly after the shock of being born. They will settle. Okay, so skin to skin helps speed that up, but they will settle. And they go into quite a relaxed state, actually. They usually stop crying, they'll go very still, and they'll just kind of take this moment in, breathing, slowing down their heart rate, thinking, where am I? Their eyes might still be closed because it still feels a little bit bright to them, but they'll have a moment of stillness. And then gradually in their own time, they begin to wake up. They start to kind of move around a little bit. It might be that this is just still a few minutes after birth, really, but their eyes might start to open and they might start to kind of look for something. And very often they'll look for mum and their head kind of raise up to you. They get quite active after that. So they start to move around. They have their mouths opening, hands and fingers will start to spread towards the mouth. They might start a few sucking movements, and that rooting reflex becomes a little bit more obvious here. So it's an obvious rooting for the breast. This can then move into what we call the breast crawl. This is where they start to move their legs and they kind of push down with their legs, and their arms can push down into your body, and they can start to kind of move themselves over to one side or the other, hunting out the breast. And this breast crawl is a natural behaviour. At any point they can rest. So resting can happen at any point where they have been really active and then they go calm and rest. And resting is normal. And you might see more resting, you might see more episodes of stillness if you have had pain relief in labour, if you've had any diamorphine or anaesthetics. Sometimes that can mean your baby just takes a little bit more rest during this process. So it could be that your baby's been with you about 35 minutes now, and then they're really starting to wake up now and look for the breast, and they're getting a little bit, maybe what looks to be frustrated, but they're not frustrated, they're just learning. Very often they can be grunting, they can be really trying to root for the breast, and there's a lot of movement. So please don't mistake this for your baby not wanting you. It is just normal for them to look a little bit frustrated at this time. This is a really important stage. This is familiarization. This is them imprinting, learning. I'm at the breast. This is what I have to do when I'm learning to feed. And this is how I get my milk. Okay, so it's a really important stage for them to move through. So kind of just let them do it. Don't feel like you need to intervene. Obviously hold the head if they're over to the breast so that they're supported, and just let them have that lick and that nuzzle at the breast. And what we're aiming for really is that they might self-latch to the breast at this point. If their instincts are raging, they're rooting, they're licking, they're moving, they're bobbing, they're crawling, they could do that themselves. Okay, so the least we do, the more they learn. So not intervening during this stage really, and just letting them be there is the most beneficial thing that you can do. If your baby, if you feel like you need some support, then we can help you. But hopefully your baby will latch and have a feed, and it's after they've fed and they've suckled at the breast that they'll go to sleep. And if you actually watch your baby during this process, you will notice these are quite observable stages. The baby will move through these stages. This is human behaviour, human baby behaviour. The problem is if we mess around with them while they're in skin to skin, which happens, and sometimes it's unavoidable and we can't do anything about that. But really what we would say is that we want to keep you both together for at least an hour. This is roughly, on average, takes around an hour, but sometimes it takes a little bit longer. For some babies it might be quicker. But really waiting until your baby's had a feed before you take them out of skin to skin would be amazing for them and amazing for you. So try not to have those interruptions really. If we need to weigh your baby, if we need to do any checks, ideally we could do them quickly at the beginning and then leave the two of you together to enjoy this time. So the key points really for this is that we have a hands-off approach. So kind of trying not to intervene. If sit on your hands, try not to touch. If dad wants a cuddle, then he can have a cuddle once baby's had a feed and you're starting to get ready. Trying to keep you both together and not separating you. Doing it immediately, as soon as possible. If it's not possible immediately, for whatever reason, reinstigating skin to skin, bringing the two of you back together as soon as possible so that you can start this process. Making sure that you don't feel hurried. Okay, so you want to be undisturbed, you want to feel like this is your time together and that you can enjoy it. So getting comfy, enjoying your tea, your toast, your coffee, your toast, whatever it is that you're having after your birth. Very well-deserved food and drink. Remembering that if you have your baby in theatre, that's also a birth room. There's no reason why you can't have skin to skin in theatre. Okay, it might be that you don't feel up to it, and that's absolutely fine. But if you're feeling okay and your baby's okay, then we can do skin to skin in theatre, and you can come across from theatre into your room in skin to skin. We can transfer you both together. Again, aiming for that 60-minute, that golden hour. Okay, aiming for that as much as possible, or for as long as you want, or longer if needed. It's completely up to you. And ideally being with mummy, it's great that your baby can have skin to skin with your partner. And that's absolutely fine. If for whatever reason they do go to your partner, that they come back to you as soon as possible. So we will now have a little look at getting breastfeeding off to a good start. Learning to breastfeed is something that you and your baby will do together. Okay, even mums that have breastfed other babies in the past will have to learn to breastfeed their new baby, because every baby is a little bit different. And all the midwives and the support workers at the hospital, on the maternity ward, and then the midwives when you get home, they're all trained to support you with breastfeeding. Okay, there is nobody that can't do that. So if you are needing some support, it's a really good thing for you to tell staff that you need that. So if you haven't seen anybody for a little while, or you're thinking that you need to ask, then please do. That's what we're there for. It's really important to do this right from the beginning, because it helps you avoid problems. It helps you avoid things like sore nipples, sore or tender nipples, which can be a bit of a pain to get rid of, but it will also make you feel more confident as well. So feeling confident, less anxious about feeding in the early days. So we're just going to have a little think about an analogy here. Okay, so we're going to have a think about a triple jumper. Some of you may know who this is, and it's fine if you don't. But if we think about a triple jumper, this is an Olympic triple jumper. Is the run-up for that triple jumper, is it important? So thinking about that, the athlete has to practice the run-up. Okay, so he has to have learned this run-up. He wasn't probably very good at it when he first started, but he's got better and he's now got it down to a T. He knows his run-up. He has to make sure that his body is in the right place and he's using his body in the right positions. And he has to get it right for his jump to be effective, for it to be effective to produce a really good jump. How he performs that run-up is going to affect that jump. Okay, the end result will be dependent. If he doesn't do his run-up right, he might have a no jump, or he might only jump a really short distance. So in short, that run-up basically is ineffective. His jump is not very good, and he could risk an injury if he doesn't do it right. So with that in mind, I want you to keep the triple jumper in your mind and think, positioning, is it important? Okay. So your baby has to learn and practice that run-up to the breast. And it helps if they're held in the right place and their body is positioned in an ideal way. It helps if their positioning is just right, really, because that will help produce an effective latch. So how you hold your baby in that run-up to breastfeeding, latching at the breast, will affect the feed. And if the positioning is not ideal, your baby might not latch at all, or they might only latch with what we call a shallow latch, which we'll talk about later. But in short, the latch will be ineffective, the feed will be ineffective, and it might cause you pain, and it might potentially, in some worst cases, cause you some damage to the nipple, some trauma that is really difficult to get past. I know that's a bit strange. Thinking about a long jumper has nothing to do with breastfeeding, but it's just to remember how important the approach to the breast is. So there's 4 points of positioning we're going to talk about today. And these 4 points can help you to hold your baby in what we would say is maybe an optimal way, really, to help them latch at the breast, and so that they can get an effective latch. And it's a great starting point for you and your baby to practice that run up to the breast to help you achieve an effective feed. And it's just really while you're both learning and gaining confidence, and eventually you won't even think about these 4 points, you'll just do them. But I think in the beginning it helps to just think, what do I need to do to set this up right? Okay. So what we're going to do is we're going to have a little look at positioning with your baby. So I've got my baby here. Okay. So one of the first things that I really want you to think about is that your baby has to be close to you when they're feeding. And you can relate this to yourself. You wouldn't want to be eating a bowl of soup with your chair pushed at arm's length away from the table. You'd want to get in there close, right up close to your soup, so that you can eat it without straining and having to lean forward. And it's exactly the same for your baby. They want to be close to you, so they want to be really close. I think what I'm going to do here is just stop that so you can see me a little bit bigger. So really we're thinking, so rather than holding your baby away from you and taking yourself down to your baby, get yourself nice and comfy and just bring your baby in close, and making sure that their bottom and their feet are nicely secure and they're supported, because babies don't like to feel vulnerable. So if their legs are left to dangle down, it could be that they feel a little bit insecure and they might be fidgeting around a little bit. So really bring your baby in close and tuck them round. I'm going to show you this in what we call the cross cradle position, but actually these 4 positioning principles, they will work in any position that you want to latch your baby in. But for the purpose of this demonstration, we'll just do it like this. So keeping your baby in nice and close. And the other thing is that the baby's head here at the back ideally needs to be free. Okay. Well, the reason that is that, well, there's a couple of reasons really, but one of them is that when your baby goes towards the breast, just literally prior to them latching on, they will naturally tip the head back. Okay. And that's so that they can get their mouth nice and wide. So they'll throw the head back unless you've got your hand there. If you have your hand here, they can't do that, okay? And it will possibly make them frustrated. It doesn't always feel very nice. And I always tend to say this at this point, is if you pop your hand on the back of your head and then push forward with your hand, it makes you want to pull away, okay? Because you can feel something pushing on the back of your head. So even if you attach your baby with the head free here, if you then bring your hand up onto the back of the baby's head, it will probably be that they will pull off the breast, okay, because they're pushing back against that hand at the back of the head. So what we would say is, whilst you've got your baby nice and close and you've pulled them and you hook them into your body, taking your hand at the base of the neck, okay, and you're leaving your baby's head nice and free here. What you're doing is you're supporting the head at the neck. And actually, if you think about it, it's not your baby's head that's weak. It's actually your baby's neck that's a little bit weak, that needs the extra support. So by putting your hand here at the base of the neck, you can provide that support to them, okay? So now you've got your baby close and you've got your baby's head free. The other thing when you look down at your baby to make sure is that their body and their head is in a nice straight line. The reason this is because if your baby has to turn their head, so if their neck and their body is not in a straight line here, it's really difficult for them to actually have a nice feed. If you think about yourself, if you were trying to take a drink, you would drink with your head and body straight. And it's exactly the same for your baby. You wouldn't try and take a drink with your head turned to the side, because it's really hard to swallow. It feels really uncomfortable. Your breathing feels a little bit harder. And it's exactly the same for your baby as well. So your baby will go through it. I'll keep going through it with you. Your baby is nice and close. The head is free. The head and body is in a straight line. A good way to check when you look down is my baby's ear in line with their shoulder? Okay, if their ear is in line with their shoulder, then they're in a straight line, and that's a nice way for you to look down at. And the last thing on these 4 main positions to remember is you have to position your babies, when they come towards the breast, they have to come in with the chin, and the nipple has to be in line with the nose. Okay, this is quite an odd one for you when you look down. You probably will think, but my baby is going to latch to my breast, so surely the nipple should be in line with the mouth. But actually, for the purpose of the latch and the mechanisms of the latch and the way that your baby moves towards the breast, they have to come in and tuck in with their chin, and ideally the lip needs to be about 3 centimeters away from the base of the nipple. Similar to your hand expressing, that kind of distance back where the milk ducts are, just here in the tissue. You aim your baby's sort of chin and lip into the breast here, and then we aim the nose towards the nipple, and we let them have a little bit of a nuzzle. So we ideally kind of rub the nipple over the lip and the nose here, and it will encourage your baby to kind of go with a wide gape of the mouth. They throw the head back, which is what we've just talked about, and then when the mouth is wide, they come up, and they come up and onto the breast. Now, when they latch onto the breast, they will latch. Try and do this so you can see. Might have to come back a little bit actually. So they come in low, they open the mouth wide, and they will come up and onto the breast, and they will take the breast tissue into the mouth here. Okay, so we'll go back to the slides and we'll have a little look at those, and then we can have a look at some pictures of what that will look like for you. Okay, so close, like we've mentioned. Head free, remembering that head free here. Head and body in a straight line, so nice and straight, not having to turn the head to get their drink. And positioned nose to nipple, so nose to nipple, so that they can come in. The nipple will then point towards the roof of the mouth. So the direction of the nipple goes upwards towards the roof of the mouth, so that when the baby's on the breast, they're on the breast with the nipple in the soft palate. If they go on to the breast, mouth to nipple, the nipple will end up on the sort of firmer, bonier structure at the front of the palate. If they go on nose to nipple, leading with the chin, so the wide mouth can open and they can come up and on, the nipple will go toward the back of the palate where the tissue is soft and spongy. Again, it's a nice little thing for you to do, is to sort of feel your own palate. You can do that with your tongue in your mouth, so kind of sweeping your tongue forward, going from the soft kind of spongy tissue at the back forward to where you feel it boning it behind your teeth. Or with clean hands, just pop your thumb into your mouth and feel around, so you can feel the difference in that structure and where it changes to soft. The nipple must be where the tissue is soft for your nipple not to get sore and for your baby to have an effective feed. And that's why these principles really help you set up that run up to the latch. So thinking about that triple jumper, that run up is close, head free, body and head in a straight line, and nose to nipple. Those 4 points, that's all we want you to think about. And you can use those principles in other positions. So we can still do close in underarm. We can still do head free in underarm. We can still do head and body in a straight line in underarm. And we can still do nose to nipple. And we can do that lying down, and you can do that in the laid back position. There's lots and lots of different positions you can feed in, but these points of positioning you can apply them in every single different position that you try. So always remembering those 4 things. Eventually you won't think about it, and it will feel perfectly normal for you and your baby. So again, if we can just see, this is obviously some photographs of those positioning, those points of positioning in action. So we've got, first of all, baby is head free. We can see nice and close to mum. That tummy is pressing on her mummy, you know, she's really, really close, and mum's holding her in that beautiful way with that C-shaped finger at the base of her neck here. Her head is free if she wants to rock it back before she latches on, and also she doesn't feel pushed onto the breast now. She's got her head free, doesn't feel like somebody's pushing on the back of her head, and she won't keep pulling back. This is your sort of early position here, this number 2. This is where you're aiming that nipple towards the nose, and the baby is about to come in chin first here. Look, so chin first, leading with the chin, scooping that bottom lip down low. The nipple is now aiming upwards into the soft palate. Okay, so when the baby comes onto the breast, the nipple will be directed right to the back of the mouth. It's exactly where you want it. So again, this is just more pictures for you to see this in action. So we've got leading with the chin and nose to nipple. It does feel a little bit strange to do this positioning, but it is really important, and it's definitely worth having a look down and thinking, is my nipple aiming straight to the mouth? I want it to the nose, but at the point your baby opens their mouth wide, then the nipple will aim towards the roof of the palate. So we'll have a little look now at signs that your baby is feeding effectively. And it's really important actually, because positioning is what we've just talked about, but now we're going to have a little look at attachment at the breast. So these are kind of 2 separate things. Positioning is the run up, attachment is the jump. Okay, so we're looking, has that been a really effective positioning to get a good latch? So it's the way the baby holds the breast in the mouth, and it's so we'll have a little look now at signs that your baby is feeding effectively. And it's really important actually, because positioning is what we've just talked about, but now we're going to have a little look at attachment at the breast. So these are kind of 2 separate things. Positioning is the run up, attachment is the jump. Okay, so we're looking, has that been a really effective positioning to get a good latch? So it's the way the baby holds the breast in the mouth, and it's really a sign as to whether they're having a good feed. So it's something that you need to understand what it looks like so that you can have a look for yourself when you're feeding. So this picture is quite nice because this is a comparative picture here. So we've got 2 contrasting pictures. So the first one is showing an effective attachment here. Okay, so this is also what we call an asymmetrical latch. It's basically meaning your baby is off center. They aren't on the breast centrally, they're on slightly asymmetrically. They've taken in a little bit more of the lower portion of the breast down here into their mouth, rather than just being on centrally. And the second picture here is showing, basically this is an ineffective attachment. So this is also called a symmetrical latch. So the other names are, for a good latch, effective latch, we've got the deep latch, we have an ineffective latch or a shallow latch. Basically the baby on this second picture hasn't got enough breast tissue in the mouth, and the nipple will be right at the front of the palate, on the hard bony tissue, rather than right at the back of the mouth like on that first picture, where it's not compressed, it's not being pinched, it's not rubbing up against anything hard. And this is really important. So some of the things that you can see here we'll run through in greater detail in a minute. But the baby's chin is really close on picture 1. So you can see the baby's come in with the chin first. There's no gapping at all between the chin and the breast. It's indenting the breast. It's close and pushing in. And if you tried to get something between your baby's chin and your breast, you wouldn't be able to, because it's pressing in on the breast tissue. Your baby also has a really wide mouth whilst they're on the breast. On that first picture, the asymmetrical latch, this deep latch, the mouth is still quite wide because they've got a nice big mouthful of breast, and so they have to keep their mouth really wide. The nose is tipped back. Look, there's plenty of room for your baby to breathe when they're latched on in this way. On the second picture, you can see the baby's come at the breast from the wrong angle. We've almost come in nose first. The chin is pushed back. We've got a big gap between the chin and the breast. The baby's mouth is quite small. It's quite narrow. It doesn't have a big mouthful of breast tissue, so it's got a narrow latch. And likelihood is that would feel very tender. If your baby's feeding in this sort of symmetrical shallow latch, it feels really sore. So you will probably know just from how it feels that something's not quite right. And potentially if that carries on, I mean, it can happen in just one feed like this, but if you keep feeding with a position like that, then you probably will start to see soreness on your nipples as well. You may get some cracks or soreness, and it's really unpleasant, and it's just something then that is then, you know, around and bothering you during your feeds. With good positioning and good effective feeding, you will not get sore. It won't hurt you to feed. It should feel pain-free when your baby's feeding. So please do tell somebody if you're experiencing pain. So we'll just run through that quickly again now. So recognising effective attachment. We have the mouth is wide open, a nice big wide mouth. The chin is touching the breast. You could also say the chin is indenting the breast. The chin will be pushed up into that breast tissue. The cheeks, which we couldn't really see on the previous picture or this one here, but the baby's cheeks will have a lovely rounded appearance to them. And you know, there won't be any dimpling or indenting of the cheeks. The cheeks will stay full and rounded throughout the whole feed. There will be more areola visible. So this is that brown pigmented part of the breast. So this is the areola here. So this big round. When your baby's on the breast effectively, you will be able to see some above the top lip here. I'm just going to turn my camera on and off. I'll do that in a minute. So yes, you'll see more areola above the top lip, and that might look like a moustache. So we tend to say your baby has moustache and no beard. All right, so that's something for you to look out for. We have a lovely rhythmical suck and swallow pattern. So your baby will be sucking in kind of rhythmical deep sucks with swallows. We're going to look at the swallows shortly. We'll come back to that. But your baby will start off with one type of suck pattern, and it will change throughout the feed. Just going to... So, feeding is pain-free as well, which we've already mentioned. So the sucking pattern then. The suck-swallow pattern of a feed changes. So when your baby first goes onto the breast, they do lots of short, rapid sucks. So your baby will suck really, really quickly, but they're quite short and sharp. They're drawing the breast tissue back. They're stimulating the prolactin with the suckling. They're trying to get oxytocin, prolactin release throughout that feed, get that rush of milk with the oxytocin release. When the milk does flow, it's something called a letdown reflex. It means that your oxytocin release has happened, and that oxytocin hormone is acting on the breast tissue to help propel the milk out. So the little tiny muscle cells around the milk duct squeeze down, and you have a letdown of milk. When that happens, your baby's suck pattern will change. So it'll go from being the sort of rapid, short and sharp sucks to switching to deep, rhythmical sucks. Okay, and they'll have little pauses. Where they have a breather, and then they'll go again, and you will intermittently see swallows as well. So a nice sort of suck pattern, deep, rhythmical with pauses. And that is the bulk of the feed, really, this deep rhythmical suck pattern. When they're coming towards the end of the feed, they can tail off into what we call flutter sucks. So these little flutter sucks will just kind of happen. They're not really kind of nutritional kind of suck, but they are still getting milk. And actually what happens when they're doing the flutter sucking is they're nicely stimulating the sort of fat globules within the breast to kind of pop out into the milk, and they get lovely rich fatty milk. So these three parts of the suck pattern are really, really good sign that your baby's had a nice full feed, and ideally you want to see these throughout your feeding. Hopefully this video will play. What we're seeing here is a baby who is effectively latched at the breast, and each time the baby throws their jaw down, one just there and there and there, the baby is swallowing. Okay, so most of the time when the letdown is in and the milk is flowing, you can hear swallows, you can hear your baby gulping. When the milk is just slightly slowing and your letdown's not there in such force, you might not be able to hear the swallows, but you can see them. So having a look down, can I see my baby's chin doing this deep thrust down, thrust, and this baby is having a really effective feed because they're swallowing on almost every suck. So every time they suck, they have milk in their mouth. And that's what you want to see, frequent swallows, lots and lots of swallows throughout the feed. If you're struggling to see swallows, or you're seeing swallows but they're really spaced out, meaning your baby's having to work quite hard per swallow, then let us know. Tell us that you're not really seeing your baby swallow breast milk. So like I said, you can often hear the swallows during the baby's feed, particularly when your let down reflex is kicking in, but you can see them throughout as well. So that's a really important thing to be looking out for. So tummy sizes then. How big is your baby's tummy? How big is a newborn stomach? So day one, the baby's tummy is tiny. It's around the size of a cherry. So it's like a small marble, a cherry, an olive, and it would be full after about 5 to 7 mils of milk. Now we know that colostrum is produced if a baby is feeding, because babies are far more effective at getting colostrum than we could ever be. They will possibly have about a 5 to 7 mil feed. So in the first 24 hours, remember, colostrum, nature's liquid gold, superfood, loaded, condensed, packed full of goodness, little kind of low volume feeds is what they're having, but it's just in perfect sync with the size of their tummy. Over the course of the next few days, obviously the milk supply will be going up and the baby's tummy will start to accommodate and grow to accommodate those increasing volumes. So by 1 week, your baby might be feeding, if we could measure on an estimate, would be between 45 and 60 mils per feed. And their tummy is now roughly about the size of an apricot. And by 1 month, it's grown again. And also your milk supply will have increased, and you will possibly be producing somewhere between 80 and 150 mils of breast milk per feed. So this is around 1 month of age. So how do you know that your baby's getting enough breast milk? Well, what goes in must come out. So your wet and dirty nappies are one of your best signs that your baby's getting enough milk, okay? And these change in the first 7 days to establish while your breast milk is coming in and your feeding's establishing. So do your baby's nappies. Day one, you would just want to hopefully see about 1 of each, but don't worry if you have more, that's absolutely fine. And then day 2, you're looking at about 2 of each. And day 3, your wet nappies start to go up a little bit. So you will start to see increasing wet nappies from about day 3. And they increase, and the easiest way to remember this is 1 per day. So on day 3, you have 3 wet nappies. On day 4, 4 wet nappies. On day 5, 5 wet nappies. And on day 6, 6 wet nappies. And then roughly it'll be in and around 6 wet nappies every day from there on, okay? The poo is starting as meconium. It's dark, it's tar-like. I'll show you a picture of it on the next slide. It's sticky and it lasts about 2 days normally. Usually by the 3rd day, the poo is starting to change colour. So it can have kind of a lighter, grainier appearance about it. It just has a different colour and a different texture. And that's a really good sign if you can see that your baby is starting to get that changing stool by about day 3. And then as your breast milk kind of pushes all of that meconium out, it becomes a very yellow, very loose poo. Okay, breastfed babies have a really runny poo, and it's normal. It's not diarrhea. It's not anything bad. It's perfectly normal if you're feeding breast milk for your baby to have a very loose poo. It's quite luminous in colour. It's very yellow, and it comes out in abundance, really. Now, what we ask is that you have at least 2 dirty nappies per day for the first, it's actually for the first 6 weeks as a minimum. Okay, so 2 dirty nappies per day, and they need to be about a £2 coin size, and that is your minimum. Most babies, particularly if they're breastfeeding, will poo more than 2. So more is fantastic and great, and don't worry about it. 2 is okay, don't worry about it. If your baby is producing less than 2, we want you to worry enough to tell us, okay? We don't want you to worry, but we need you to tell us. What we would do is we would probably need to have a little look at your feeding and just check it, just see if there's anything that could be a reason as to why your baby is potentially only producing less than 2 poos a day. And that's your rough guide on what goes in must come out. If you have any worries about wet and dirty nappies, please do get in touch with your midwife. So the other thing is your baby's behaviour. So this is before, during and after a feed. So how are they? Before they feed and after they feed, how are they doing? So keeping an eye out on that. Also the suck swallow, we've mentioned sucking, we've mentioned swallowing. So that suck swallow, how many times do they have to suck before you get a swallow is really important. And the minimum amount of feeds that you need to have in a 24-hour period is 8 to 12, okay? So 8 being the minimum amount of times your baby needs to feed. But if they're feeding more than 8, then that's absolutely fine. And please, don't worry about that. That's very normal for a breastfed baby. How do you feel during a feed? Okay, is it comfortable for you to feed? Are you having any pain? What do your breasts feel like after? Do they still feel full? Are you having any blocked ducts? Does it feel lumpy? Does it feel bumpy? If there's anything that's not quite right after you've fed, please do let us know. The other sign that you really need to get used to checking for is also, what does your nipple look like when it comes out of your baby's mouth? Okay, it should look the same shape as when it went in. Okay, so what you don't want to see really is any kind of pinched appearance to the nipple. Does it look flattened? Does it have like a lipstick shape? Is it sort of got a slant down one side? If it has any misshaping after your baby is finished feeding, again, we probably just want to check that latch for you, that effective attachment, and just see if it does look okay. It could be that there's just a few tweaks that need to be made to make sure that your nipple is directed right the way back into the palate. And also we will weigh your baby for you. So usually the first weight takes place on the 5th day after the birth, and then we will re-weigh your baby following up from that around sort of day 10 to 14. And again, your health visitor will re-weigh your baby for you as well. So babies can take a little while to get back to their birth weight. It's very normal for babies to lose weight initially. They normally lose weight in the first couple of days. So when we weigh them at day 5, we pick up that they are below their birth weight. Please do not worry if your baby is below the birth weight, that is normal. What we would do is just work out how much below the birth weight they are and see whether there is anything that we need to do to support your feeding if they've lost more weight than expected. But weight loss is normal. What we do want to see obviously is that your baby is gaining weight, and usually most babies are back to their birth weight by about 3 weeks after the birth. So these are your dirty nappies that we've mentioned. So we've said obviously meconium day 1 to 2, you're changing stool day 2 to 4, at least 2 soft runny poos a day from day it's from day 4, but definitely I'd be looking out for that for day 3 too. And that your baby will develop their individual peeing pattern by about 6 weeks, sometimes a little bit earlier, but really do keep your eye out for those 2 peeing nappies a day. Meconium is that top picture that looks very dark. So we're just going to now look at responsive breastfeeding and early relationships. So when should you feed your baby? How long should you feed your baby? When's the right time to feed your baby? Well, what we recommend is that you do something called responsive breastfeeding, and it can be a really wonderful experience for both you and your baby. It's a reciprocal feeding relationship. It's something that works for both of you. But what does it mean? Well, it means that really you want to be responsive to your baby. So if your baby's telling you that they're hungry, you respond to them and you feed them in line with their signs and their cues that they're hungry. And you would do that. It's kind of what we've always called feeding on demand. We continue to say, feed to your baby's cues. Put simply, it's your baby's body language. It's when they're telling you, I'm starting to get hungry, Mum. I'd quite like a feed. So responding to them early, not allowing them to get to the point where they're crying for feeding, really kind of trying to spot the signs early on so that they don't have opportunity to become really distressed. And also in the earlier days, that makes it a much calmer feeding experience for both of you. And also while you're learning, it makes it easier to latch your baby to the breast. So let's just have a little look at what the cues look like. We've got some early cues and some mid cues for you here. So early cues are, I'm hungry. This is body language to say I'm hungry. We often just get stirring in the cot, baby's waking up. Just thinking about, becoming more alert. You might start to notice that opening and closing their mouth a little bit. They might be turning their head. They might be seeking something out to suck on, their fingers, their sheet, their arm. If you pick them up, they might root on you, and have a little go at trying to latch to your face or your cheek or your shoulder. So then they're nice early cues that your baby is waking for food. Your middle cues are a little bit more obvious. You might get more increased physical movement. You might get more hand to mouth action, actively trying to suck on something, particularly fingers. Lots of stretching. You might get a bit more noises from your baby, maybe some grunting, and just some signs that they're kind of really, really getting hungry now. So this is more than I'm hungry. This is, I'm really hungry, Mum. I'm ready for a feed. So observing for these feeding cues is going to be really useful for you. So the next part of responsive breastfeeding is really a little bit more than demand feeding. So that's part of it, is feeding to your baby's demand. But the other part of this is really meeting their other needs and also meeting your needs in feeding as well. So this is where you both have the opportunity to be happy with breastfeeding and making it work for both of you. Okay, so you can basically offer a feed anytime where it feels right for you and your baby. There's never a wrong time to offer a breastfeed. It could be that you offer feeds for your needs or your baby's needs, and that might be that you feed for nutrition. So like we've mentioned in response to the feeding cues, it could be that you're feeding for comfort, because you or your baby needs to feel comforted by the feelings that you get when you breastfeed. For mums, it could be that it actually feels quite nice to just sit, cuddle your baby and have a feed and forget about the housework and forget about the cleaning, forget about the fact that you feel tired. You're just going to sit there and enjoy that time together. When you breastfeed, you are flooded with oxytocin. So oxytocin is this happy hormone, the hormone that brings on the feeling of calm. So it could be that you do experience that when you breastfeed. It also makes you feel very in love with your baby. So you might actually seek out breastfeeds because you just adore your baby. And that's absolutely fine too. So feeding for comfort and love is part of responsive breastfeeding. It might be that you need to feed for convenience. So you need to feed because you need to feed. It could be that you're going out. It could be that you've got visitors coming around and you'd rather feed before or after. So you can instigate that feeding because it suits your day. It suits your needs at that moment. It could be that you feed to settle your baby. Maybe your baby's feeling a bit grizzly today. They're having one of those days. It's hard to settle them. But you know that if you offer them a feed, they probably will. And you can feed to soothe, because obviously things happen. Babies have tests, they get weighed, they have injections, there's lots of things going on with them, and it could be that actually when they're crying after they've had that done, that breastfeeding will help calm them down and make them feel better. It could be when they're older, they're teething, and you can tell that they're uncomfortable, and offering a feed gives them that soothing relief that they need. So you can never overfeed your breastfed baby. It is impossible. And you cannot make a breastfed baby feed if they don't want to. And it is just physically impossible to overfeed. And breastfeeding can therefore be part of your mothering. It could be part of the way that you and your baby work together in your relationship. And it actually can be really empowering for you to know that you've got this thing that you can do that basically just sorts your baby out no matter what. So that, you can get plenty out of breastfeeding too. It is not just about your baby's nutrition. This is a quote from a second-time mum who completely embraced responsive breastfeeding the second time round. And what she said about responsive breastfeeding is that if you feed your baby for comfort, the nutrition is just going to take care of itself. Don't have to worry about it, because your baby will feed so much for just being with you and comfort and to make themselves feel better. They're going to get more than enough milk during that time. And it's a great approach for you, really. It helps remove a lot of the worry about nutrition and is my baby getting enough milk, and it brings, you know, lots of benefits for you and your baby. So we talk about responsive breastfeeding, we talk about responsive feeding and being responsive, because it has a huge benefit for your baby's development. It helps with their brain development under the influence of oxytocin. It's basically helping to grow their brain, but in a way where they feel safe and secure. Just have a little look at what I mean. So baby's brain development actually starts with them in your tummy. So now, whilst you're pregnant, your baby is developing their brain, and there's lots of things you can do in pregnancy to help this process. So things like talking to your baby, you know, stroking your bump, taking time out in the day to perhaps lie down and have a think about your baby, bring on that rush of oxytocin that will flood your baby's brain while they're in your tummy, and it basically cements their neurons and their synapses under the positive influence of oxytocin. But babies are born with billions of brain cells, billions of neurons, so many neurons. There's just the most neurons that you can ever measure, really. We're talking like billions, but they're not connected to each other yet. That's what happens once they're born, and those connections are what you can influence, basically. So how your baby grows their brain is something that you can help with, and they build these connections every time they have a positive interaction or every time they have a negative interaction. Something happens to them, they learn, and they build a synapse, and the more times they experience that, the stronger those synapses get. So the more they experience positive experiences, things like being talked to, sung to, touched, stroked, rocked, fed, responded to, soothed, they build and strengthen those positive synapses, those positive connections between brain cells. When things happen, if they're left to cry for long times, if they're not responded to, if they're not picked up and nurtured, they will build synapses for those negative experiences. And so you're building the foundations of your baby's brain, and that basically sets them up for their future. This is just a really nice image just to show you kind of how quickly your babies build their brains. So the synapses aren't there at birth, and they grow at a really rapid rate in the first, well, actually it's the first 5 years, but certainly you can see how quickly they grow here. It's quite an amazing image, actually. So what we're talking about really is a 4th trimester. So obviously you have your 3 trimesters with them inside you, and then they're born, and that period of time where they're learning their new environment and getting to know you and getting to know their life, that's their 4th trimester. And they're still developing, and by providing a safe, secure environment and being responded to by you and by your partner and by the people around them, then it helps them to build their brain with secure attachments. You know, they learn that you're always there, and they learn that you're not going away, and they actually become really confident children. We have disproven, we're unlearning what we thought about them. It's not possible to spoil your baby. They cannot vie for your attention. They aren't being naughty. They're not neurologically capable of that yet. So right now they're acting on instinct. They're crying for you because they need you. And if they need you, they want you to respond to them. And if you respond to them, you flood them with oxytocin and you set those secure attachments, and they become strong. So it's just absolutely not possible to spoil your baby with too much love. We'll have a little look at that now. That support when you go home. It varies, depends where you live. If you are living in our local area, so the areas that our infant feeding team can visit you, that would be Kirkby in Ashfield, Sutton in Ashfield, Mansfield, Warsop, Mansfield Woodhouse, Warsop, and then Ravenshead, Blidworth, Clipston, Ollerton, Newark, Southwell. All of those villages really within our environment, within our local area, then we can come and visit you at home. And we have the Lime Green Infant Feeding team, who are our amazing team of support workers who can do home visits. What they will do is they will contact you. They normally ring all mums who've gone home breastfeeding, and they'll ring you usually the day after you've gone home. So you'll have your midwife come and visit you the first day after you get home, so she can support you with some breastfeeding. If you've got any problems, she should be checking breastfeeding for you. Please do make sure if you've got any questions, you do ask them during that visit. The Lime Green team will then usually come and visit you after that. So once you are discharged from your midwife, you will be passed over to the Healthy Child teams. So these are your health visitors, and they will have people in their team who can support you with feeding. If you don't get contacted by that team, please do ask for the help. They are there to support you, so please do ask. If you're out of area, I can't tell you what support you've got when you go home locally. So if you're not living in any of those areas that I've just mentioned, then probably the best thing to do is ask your community midwife when she comes to see you on your first day home if there's any other support you can have with breastfeeding. Okay. If you would like to contact our infant feeding team, and that includes myself and my colleague Natalie Boxall, who's the other specialist midwife, and any of our Lime Green support workers, then you can contact us on this email. This email is checked every day, apart from weekends, but it's checked every day, and so we can respond to queries there. If you would like a liquid goal kit to do some antenatal hand expressing, please do email us on this email address and let us know. We will contact you and arrange for that to be either picked up or delivered to you. Okay. If you have your baby and nobody's contacting you, the best place to ring really, rather than emailing, because in case that email doesn't get checked quickly enough, is to ring the community midwife advice line. So that line is active Monday to Friday daytime hours, and the emergency midwife number is active 24 hours a day. So if you need more urgent advice on breastfeeding, please do use the telephone numbers rather than the email address. National breastfeeding support around and about for you. There are lots and lots of places, nationally. I've put these on here because I think these are really useful. We've got the Start for Life breastfeeding friend. This is actually this is accessed via the Facebook Messenger. So if you have the Facebook Messenger app, you can get the breastfeeding friend on that, and 24 hours a day, 7 days a week, you can ask a question into that messenger and it will fire back the answers. Okay, so what you have to do is go to your Facebook Messenger, search Start for Life. It's all one word, Start for Life. It will bring up the option to sign up to the breastfeeding friend. So you just sign up follow the instructions and sign up. And then you could pop into that any question, my baby breastfeeds a lot at night, is this normal? And it would bring you some information back about that question. Okay, so it's a really useful app. It's fantastic. We get lots of positive feedback about that one. The Association for Breastfeeding Mothers, the ABM, have a really good website, along with the Lalesh League GB. They both have really good websites with videos, articles, lots of answers to questions, common questions. So you can always just browse their websites and see if your answer to your question is on there. And then there's the National Breastfeeding Helpline, which you can ring for help on breastfeeding 24 hours a day. And that's usually manned by peer support workers who are trained, breastfeeding mothers who are trained to help you with any queries or problems, and sometimes it's just somebody who can listen to what you've got to say. Okay, so please do use these resources. They're there to support you. Don't ever feel alone when you are breastfeeding. Please do reach out. You can get support. It is out there for you. So thank you very much for coming. It's been absolutely lovely to be able to talk to you today about feeding. If you have any questions, my name's Jenny Gilbert, my colleague is Natalie Boxall, and we're here to answer any questions you need. Okay, thank you, bye.